So this is um, a presentation on the infectious disease topics. There are some specific topics, um, some small specific topics that I think should be important to know before the NAPLEX exam. And we will kind of talk about some of the drugs in this topic that specifically correlates with that type of infectious disease. Um, just keep in mind this is not an all inclusive or every single disease presented here. Um, I will kind of give you a short introduction as to what it is, some of the causes of that particular disease, and some of the treatment options that are used in those kind of disease states. Now, when it comes to infectious diseases, they might not be a just give me 1 second here. It looks like we are having a little bit of trouble. Okay. So when it comes to infectious diseases, some of the treatments here are not okay. Before we start, I want to make sure I have the video. I'm going to pause this video for a minute because it looks like we have a few people who are still trying to log in and probably gets into it. So um just gonna give you guys a few minutes, okay? Anyone that's already signed into this video. As I mentioned, there are a couple of infectious disease topics that I believe are kind of important to know, especially for the NAPLEX exam. Um, as you guys are studying and reading the materials, you should also understand the fact that some of the information that's presented in the books, um, you might see them in these slides here, or you may not see some of the information that's in the uh, you know books from the slides. So but when it comes to appropriate for that particular disease. So, and when it comes to infectious diseases, it can be kind of tricky and tough to understand which kind of antibiotic should I use. Is it going to be a broad spectrum antibiotic? Is it going to be a narrow therapeutic range, or is it going to be like an empiric therapy? So you have to understand. And I didn't say my name. My name is Snehal Desai. So if anybody has any questions, feel free to any patient cases. You need to know, number one, does that patient have any drug allergies? Now, patients may have allergy. Usually you might see a patient case that says they have allergy to penicillin. And you can automatically eliminate some of those answer choices when it's other times you might have patients that have macrolide allergy and that they have to take a drug to treat someone who has a H. pylori infection. So you need to know from our previous presentation, we already talked about the upper GI tract infection, and we talked about H. pylori. We talked about triple and quadruple therapy. The triple therapy is not really used anymore. Quadruple therapy is because there is, that resistance is very low. Then obviously a patient can still use macrolide to cover that bacterial patients can use too, to kind of back them up with that coverage. So, anyways, going into this presentation, I just wanted to mention the fact that you have to know what kind of treatments are needed to prevent or to treat these infections. So we're going to talk about some of the things here. These are just little subsections. You might have a question or two about any of these kinds of infectious disease. So it's I'm going to just briefly cover it, very brief. This is not a very in-depth review. I do hope that you guys are going to look more into this in your NAPLEX materials as you study, because it's still, even though those kind of infections. So let's take a look. So as I mentioned earlier, and my table is a little bit it's a little bit different here. It's on a different device. So but anyways, generally these are the topics that's generally you would see on like the NAPLEX exam. Now, I'm not really gonna get much into the special cases portion. We're not gonna look too much into renal adjustments and stuff. I'm sure your book already has like those key drugs that needs renal adjustment. Pace less than like 30 or 20. You need to understand like which drugs should I use to not only make sure it's safe, specifically because when trying to treat the antibiotics used against Pseudomonas aeruginosa or Pseudomonas infection. Another thing here is the pneumonia. We briefly already covered that in the previous videos. Pneumonia is a infectious disease that can range from like someone having community acquired pneumonia, hospital acquired, or nosocomial infection type of pneumonia, or hospital associated pneumonia. So you have to understand those differences there. Specifically, if patient is on ventilator, and then how long it takes before they get pneumonia infection, and what kind of antibiotics. Some of the vaccinations are especially important when it comes to timing, especially like things like hepatitis B, hepatitis A vaccines, knowing the timing between shingles vaccine, how often to get flu shot. Everyone pretty much knows you should be getting it once a year. Then there's this new ones that some of you may not have noticed, maybe while you were in school, or maybe you did notice it. Understanding that RSV vaccine, like a Arexvy and a Briswell, when should either one of these vaccines be given, and what age group should we be giving them to? So all of that. So we'll take a look at all of that. These key points are very important to understand. So I would take note of these types of questions so you can ask yourself as you're studying about these vaccines. I will also post a question or practice question review on some of these concepts so you guys can get better at on answering certain types of questions on our things from your book, so you guys have a better foundation knowledge before taking the test. So let's take a look. Does anyone have any questions so far? Over prepared, because your preparation is so that you are first you have to meet the minimum competency of this exam. So definitely highlighting all through all those that on your own time. Make each of those that as you're studying these topics. Now, these presentations are intended to be as a preview, so it's just to give you a little bit of touch up topics on medications, diseases, mechanisms. Some of those things are on the NAPLEX outline. So take all of that in consideration when you're studying for this exam, because it's not an easy exam. And I've been seeing many of your posts about how difficult times that some of you are having to passing the exam, and then some of you are also review better before the exam, because everybody's exam is going to pretty much be different. So, but I don't think you guys are gonna lack the ability to, practice just by failing one exam. You guys will be able to, but you guys have to work on improving your skill, working for concepts, and keep practicing those questions. Drugs. There's 200 questions on there on practice questions there, and you guys can go over those questions too, because those top 200 drugs is going to correlate with that disease state, so you guys should be able to do that. So definitely review all those things as well. And the multiple choice mention about was the UTIs, skin and soft tissue infections, intra-abdominal infections. We're going to look at osteomyelitis, endocarditis, sepsis, vaccinations. We're going to look at all beneficial for you as you study for this exam. So take a minute, and also utilize these tables, and ask yourself what live vaccines, and is it appropriate for a patient? You shouldn't be giving live vaccine to a pregnant patient anyways. Gives you a little bit idea as to how to kind of look at things like then 24 hours after a surgical procedure, physiologic actions as well. Cefepime, one of the specific types of cephalosporins. So when it comes to cephalosporins, think slide here. Healthcare associated would be, and I'll type it. Move on to this next one because there's quite a bit of information here. Really, all it is what used when infection occurs. Then how's the bone marrow supposed to make those white blood cells to protect it here and the words here, so that you guys cause from this could be patient having a diabetic foot infection. Recent, maybe they've undergone as important lab values. I think you guys. And it says that typically 6 weeks duration of antibiotics is needed to for coverage. So I think so typically, you got patient very is this patient going to have like low blood, and you could see diabetic foot infections. Does this patient have diabetes? You want to look at that too, so, and all of that is a important factor, in understanding to look at it. You have to look at a case for the cultures to come back in drugs, so that they're going to be covered first prior to optimizing. You guys need to know that a mechanism. You're probably going to need to look at that as I don't know if I mentioned a previous slide, but I believe it's going to be, because this one might have a little limiting factor in, like linezolid, for example, another type of antibiotic patient would be on. Is it going to really help? And then Um, so when it comes to choosing appropriate antibiotic, you want to definitely limit the option. Now, if the patient has penicillin allergy, and they have some sort of like allergy to daptomycin, you can probably eliminate the option and choose meropenem. Fluoroquinolones, you probably might not see a lot of that, but sometimes patients need some fluoroquinolones. Sometimes they need ciprofloxacin. Sometimes they need levofloxacin to cover it. There could be infections there, and it could be native valve or prosthetic valve, so it could be divided into either of these categories. So try to understand what type of infection and which one. Streptococci is usually more. It's like it could patient would have a native valve and then they're going to need a Vinco or cefepime, so they might need some kind of coverage there, especially for something like MRSA. Look at the updated stuff. um Again, duration is about 6 weeks of IV therapy while on these antibiotics. Sepsis, now serious concerning sepsis. So but sepsis overall is a life-threatening organ dysfunction. Whenever a sepsis infection is occurring, is because the body is patient starts out with the infection by the bacteria, problems and circulation changes occur, and then because of that abnormality, then the other organs are gonna stop functioning, like lung. Patients will start to have these kinds of symptoms, trouble getting hot oxygen, might get to acute kidney injury, confusion or coma, low blood pressure, poor perfusion, noradrenaline, something to get that vascularity running. So they're going to need that. They're going to need something for their heart too to get it started pumping that blood out. So they're going to need that reward motivation inside the brain. Dobutamine is going to specifically, or the cardiac output. So it's going to help with that heart. Um, so just kind of understand that. Now these aren't antibiotics, but these are important medications for the blood moving. They're going to need. Then you have, these are just the different categories of the sepsis, as I mentioned. Like it starts out with sepsis, but then if not treated, it starts to get severe, and it's septic shock being the worst. So sepsis gonna start out like that, and some of the signs and symptoms are stated here. So know that for the exam, when their fever and temperature is going to get really high, or they're gonna experience fever, or if the temperature. So just understand that. And then some of the empiric broad spectrum antibiotics like Zosyn, seen in diabetic foot infection, necrotizing infections, um, skin and soft tissues. This is just a description of what it would look like if the patient was experiencing any of these.